Hi everyone, my name is Jing Chong and today I will be presenting our integrated group presentation on case scenario 2. This is our case scenario. A 33 years old male named Mr. Shaky Lee suddenly had a fall and was seen with uncontrolled jerking movement. He sweat his pants and lost consciousness for 80 seconds. Upon arrival at the hospital, he complained of frequent headache previously to this attack and could not recall the entire episode. Upon further physical examination by the doctor found that he has difficulty with coordination and was confused. Therefore, the doctor ordered IV lorazepam 4 mg stats and PO sodium valproate tablet 300 mg BD for 1 month. With all this presentation, I'll conclude that he was suffering from tonic-clonic seizures. Now I'm going to talk about the pathophysiology of it. So, seizures happen because of an abnormal electrical discharge either from the central area of the brain or restricted to one area of the cerebral cortex, or lastly, localized area of the cortex. This group of hyperexcitable cells are called epileptogenic cells. Epileptogenic focus. So when a neuronal excitation from the epileptogenic focus spreads to the midbrain and the reticular formation, it will cause seizures. Here are a list of risk factors. One will be age, which can occur to any people of any age, family history, head injury, stroke and other vascular disease, as the damage to the brain might cause seizures. Dementia is shown that the risk of having seizure increase in older adults. Brain infection and seizure in childhood, usually those that experience long seizure episode when they are young. Next, I'm going to talk about the clinical manifestation. Number one, which is aura, which is an abnormal sensation, usually is a warning sign of a seizure attack. Next, I'm going to talk about the activity experienced during a seizure. First will be the tonic activity, which includes the loss of consciousness, crying and moaning sound heard due to the spasm of the lungs muscles, saliva and foaming from the mouth, gasping and gargling sound due to the impaired breathing, and it will last usually 15 seconds to a minute. Next will be the clonic activity. Included was jerking movements became intense and rapid. Jerking movement will slow down after 1 to 3 minutes till the body relaxes. Breathing will return to normal after letting out a deep sigh, and it will not be more than 60 to 90 seconds.
Hi, my name is Rishi. So now I will be talking about the diagnostic tests. We'll do some diagnostic tests to find out the causes of the seizure. First, we will ask the patient, family member, or any observer about the process of the seizure, like for example the duration of the seizure or any cognitive problem that happened after the seizure. Next, we will perform a physical assessment on the patient, such as neurological and higher physique function tests. So these two tests is to test the behavior, monitor motor abilities and mental function of the patient to determine whether there's any problem with the brain and the nervous system. Next, we also do some laboratory investigation. First, we will do a renal panel test to check whether the renal problem, which may contribute to the seizure happen. And we also, at the same time, we will also check the creatine kinase level. As creatine kinase level will increase after a seizure happen. Next, we will do a full blood count also to check any abnormalities that may affect the choices of appropriate anticonvulsant medication. We also assess the overall health and identify any condition that may be triggering the seizure. Next, do the liver function test, as this is to find out any contraindication of the anticonvulsant medication. And for lumbar puncture, if the doctor suspect that there's any infection that caused the seizure, the doctor will perform a lumbar puncture to check whether there's any infection or tumor. So next, we'll perform EEG to confirm the diagnosis to see whether the brain activities, and we also do a CT scan or MRI scan of the brain to see any lesion or any abnormalities of the brain that cause the seizure. And lastly, we'll do an X-ray of the skull to check whether there's any bone injury. Next, for medication management, we will give the patient anti-epileptic drugs such as lorazepam, phenytoin, and sodium valproate. So next, a physician may prescribe a ketogenic diet, which is a diet that high in fats and low in carbohydrate to help to control the seizures. And usually the body uses carbohydrate to produce energy, and as the ketogenic diet is low in carbohydrate, so fats become the primary fuel instead. So the body can work very well with the fats, which is ketones, and it's not dangerous. So the higher ketone level in our body, which often will leading to improve the seizure. So next, we'll talk about the surgical management of the seizure. The first is remove of the epileptic focus, which is a small portion of the brain where the seizures originate, normally at the temporal lobe. Second is laser interstitial thermotherapy. This is a less invasive surgery which uses a laser to destroy the affected brain tissue. Next is vagus nerve stimulation therapy. This therapy is where we implant a flat battery into the chest wall, and it is attached to the vagus nerve. So the battery will produce impulse to the brain and to decrease the amount of seizure. Next, we have corpus callosotomy, which is removal of the corpus callosum. The corpus callosum consists of many axons that interconnect with the two hemispheres of the brain. So this is to prevent the abnormal brain activity to spread to another brain. Now I will pass to Kaushan.
Hello, my name is Kaushan. Now I'm going to talking about nursing care management. The first is keep the patient away from obstacles that may harm them. Clear the area of any harmful items such as sharp objects. Place a pillow, blanket, jacket, or other soft objects under the patient's head if available. Be sure that the patient is not facing down to prevent suffocation. Okay, monitor and take note information about seizures. Is including the time of the seizure begin and stop, and body movement during the seizure. Okay, last. Sleeping pattern should be consistent to avoid insomnia. Maintain in lying position, flat surface, turn head to side during seizure. Loosen clothing from leg or chest and allow the patient to sleep. Last, promote airway clearance. Following the seizure, it's important to continue to monitor patient's airway, use suction as needed, prevent aspiration due to excessive saliva production, and ensure their airway remains patent. Suction and oxygen must be available. Enforce education about the disease. Review pathology of condition need for treatment as indicated. Discuss patient's particular trigger factors such as flashing lights, loud noises, video games. Educate patients the importance of good oral hygiene and dental care. Last, monitor of vital signs is imperative, especially respiratory function. Now I pass time to Pei Fang.
Hi everyone, my name is Pei Fang and I'm going to talk about the patient's education. So firstly, we will actually teach family members first aid for seizures. So for first aid for seizures at home will be like having a cushion for the head, loosening the tight clothing and restrictive clothing of the patient, and also turn the patient to a lateral position and do not put any thing into the mouth, and ensure that do not restrain the patient when the patient is actually choking. Next, instruct them to call for medical assistance if the seizures is more than 5 minutes. So this is to actually minimize any injury and also have better recovery. So next, we will advise the patient to take his medications correctly. So medications are to be taken the right dose and also to take at the same timing every day. This is to actually to control the seizures and also reduce any relapse. Okay, next, we will also educate patients about the drug interactions with other prescribed drugs or the over-counter drugs, or even, let's say, food. So some examples of drug interaction will actually decrease the effectiveness of the drug and also cause toxicity to the patient. So lastly, it's to actually recommend patient to actually purchase and wear a medical alert bracelet. This is to actually allow passerby to know what is happening to the patient. If let's say patient actually have a sudden episode of seizures outside in the public, passerby will actually know that the patient is actually having seizure, and they will actually bring the patient to medical attention and for appropriate treatment. So for patient education, we actually included in our role play at the back. So please refer to the video for more information. Okay, hi everyone, my name is Pei Fang. So now we will proceed to talk about the fun part. So there's two medications that were given to our patient in our case scenario. First is actually lorazepam, and the second one is sodium valproate. So for lorazepam, the MOA is actually to enhance the inhibitory actions of GABA, preventing neurons from firing rapidly and therefore reducing brain excitabilities. So as for sodium valproate, it blocks the sodium and calcium influx and enhances the actions of GABA, thus preventing the neurons from firing rapidly and reduce brain excitability. Okay, so next I will talk about the indications of the medication. For lorazepam was given through IV 4 mg and it's given stat. So it's actually used for suppression of abnormal neuronal foci that may actually cause seizure. So what is abnormal neuronal foci? It's actually abnormal brain activities. So next, I will talk about the sodium valproate. So the indications for sodium valproate is actually useful for a wide range of seizures type. So now I'll talk about the contraindication. So for lorazepam and sodium valproate, if you actually have drug allergy to both of these medications, it's advisable that you do not take this medication. And so for lorazepam, if patient is already having respiratory depression, we usually will not give patient this medication, as it will actually worsen the respiratory depression. And if patient is also having a eye condition called glaucoma, we will also not give the medication to the patient. And for sodium valproate, if patient is having any liver disease or pancreatitis, we will also avoid giving patient sodium valproate. Okay, so next I will actually talk about the common adverse reaction. So the common adverse reaction for both medications is drowsiness, ataxia, bone marrow suppression, and blood dyscrasia. Okay, so for the severe adverse reaction, for lorazepam, it will actually cause both lorazepam and sodium valproate will actually cause hepatotoxicity, and for lorazepam, it will actually cause respiratory depression, which will actually lead to cardiovascular collapse, because patient will actually have bradycardia and also tachycardia to replenish the circulatory. So for sodium valproate, it will also cause fatal acute liver failure and pancreatitis. Next, I will pass it over to Natasha.
My name is Natasha, and I'll be talking about the special effects of lorazepam and sodium valproate. So for lorazepam, the antidote is flumazenil. The drug interactions is do not use with opioids because it increases the risk of sedation, respiratory depression, coma, and death. So for food interactions, lorazepam cannot be taken with alcohol, caffeine, and grapefruit juice because of its the increased sedative effects with caffeine and increased plasma concentrations with grapefruit juice. For sodium valproate, we cannot mix the valproate acid syrup with any carbonated beverages because it triggers immediate release, causing severe mouth and throat irritation. We should also not chew or pound extended release tablets, and it cannot be taken with carbapenem. Okay. Next, I will be talking about the nursing considerations for lorazepam. So firstly, we need to obtain the health history to find out if the patient has any neuro, cardiovascular, hepatic or renal disease, any glaucoma or pregnancy to identify if patient has any contraindicated conditions. So you need to find out the patient's drug history, including the allergy and the current medications, to prevent any anaphylactic shock, as well as drug-drug interactions. Thirdly, you need to observe the characteristics of seizures, such as frequency, duration, and symptoms for increased or reduced occurrence of seizures after treatment to monitor the response and therapeutic effects of the drug. Fourth, we have to assist in ambulation, because anti-epileptic drugs increase drowsiness. They cause drowsiness, increasing the fall risk. And lastly, we need to monitor the IV site for any pain, edema, erythema, and temperature, as these are signs of extravasation. Next, I will be talking about sodium valproate's nursing considerations. So, generally for sodium valproate, the nursing considerations are mostly the same as lorazepam, except for some that are specific to sodium valproate. So points number 1, 2, 3, they are the same as the one before for lorazepam, which is to obtain the health history, obtain the drug history, and observe the characteristics of the seizures. But the specific ones are to monitor the serum drug levels periodically and to note for any signs and symptoms of drug toxicity to correlate the drug levels with the patient's symptoms. So lastly, concurrent use of CNS depressant drugs increase the sedative effects of antiepileptics. So next, I'll be talking about the health education. So the first health education is to instruct the patient to take the drug exactly as prescribed and not stop it abruptly, as stopping the drug could lead to recurrence of seizure attacks. Secondly, seizure diary is to monitor the response and therapeutic effect of the drugs. Thirdly, the anti-epileptic drugs can cause bone marrow depression, which results in leukopenia, anemia, and thrombocytopenia. Sodium valproate may also cause weight gain, hypotension, and respiratory depression, which are serious adverse effects of lorazepam. Lastly, the medications are supposed to be taken at the same time every day to ensure the effectiveness of meds. So next, we will take a look at our role play on our health education, and that concludes the end of our presentation. Thank you.
Good morning, Mr. Lee. I'm Staff Nurse Tan. So today you'll be going home, so I will need to teach you how to take your medication. This medication is actually sodium valproate. It's actually a control release tablet. So for this tablet, right? For the first thing I need to ask you, do you have any drug allergy?
No.
Okay, so no drug allergy, yeah. So this medication is actually to control your seizures, because you recently just had your seizures, right?
Yes.
So this medication is actually to control your seizures. So you need to take note that these medications, even if you are better, do not stop the medication. Doctor have ordered 300 mg and to take 2 times a day for at least a month first. Then after that, most probably you need to come back and review with the doctor and see if your seizures is getting better. Then the doctor might review the dose. But for now, you need to take 300 mg 2 times a day. Okay?
Okay.
Any questions?
Can pound the medication or not?
Oh no, this medication cannot be pound, because this medication is actually a controlled release tablet. So you need to actually, it will actually go into your digestive tract and it will slowly release the content of the medication. So and it's to control the seizures over a period of time. So it's best not to pound the medication, as it will lose its effectiveness. Okay? Any?
So I want to give Sir the medicine with bubble drink can?
Cannot, because this medication, if you actually take with the gassy drinks, right, like your Coke and Sprite, it will actually cause irritation to your mouth and throat lah. So cannot give together with gassy drinks, okay? Just plain water will do.
Okay.
Okay, any more questions?
That's
No?
all.
Okay, thank
Thank
you.
Thank you.